The definition of a true aneurysm is an aneurysm bound by all three vessel layers, but pseudoaneurysms, also termed false aneurysms, are not. But what does this mean exactly? True aneurysms can be congenital or secondary to loss of structural integrity of the vessel wall, often secondary to atherosclerosis and/or hypertension. This leads to a focal widening of the vessel, either symmetric, so-called fusiform, or asymmetric outpouching, so-called saccular. Intravascular thrombus formation is also common within the sac. This widening involves all three vessel layers, the intima, media, and adventitia. On the other hand, pseudoaneurysms represent a contained rupture with a connection to the vessel lumen. Imagine that you have a vessel wall injury leading to a hemorrhage contained by the adventitia or a wall of fibrin, but still receiving blood from the lumen. I often imagine this as a hematoma with active flow. With true aneurysms, the size and growth rate are reliable predictors for the risk of rupture, but not for pseudoaneurysms, so the latter tends to be treated promptly. But can we easily tell them apart on imaging? The clinical scenario here is crucial. Is there a history of trauma or other vessel injury? The location is also helpful. For example, a vessel outpouching in the groin after a vascular access is a classic location for a pseudoaneurysm, which is a secondary iatrogenic injury of the vessel wall. This will show the classic yin-yang sign on ultrasound, which represents the swirling blood flow within the contained rupture. On the other hand, an abdominal aortic aneurysm is a classic location for true aneurysm. The form is also helpful. True aneurysms tend to be fusiform, unlike pseudoaneurysms. Secondary signs can also be helpful. Since a pseudoaneurysm is often caused by trauma and represents a contained rupture, there is often a reactive change around the pseudoaneurysm, which is less common with true aneurysms since it's caused by progressive loss of vessel integrity. Note, however, that reactive changes around a true aneurysm are alarming signs and may indicate impending rupture. So in any case, it's always helpful to look at the adjacent fat planes.